All right, in this video, I want to talk about 5 signs that are indication that you can benefit from physical therapy to relieve your back pain. And this is going to be super helpful for some people, even for those people who have had physical therapy before and maybe have not done as well or failed physical therapy. This video is going to be helpful for you to not only let you know where you may have gone wrong, but to reinforce why physical therapy would be able to help you in your current circumstance regarding your pain in your back, whether you've had a traumatic injury from a car accident, whether an issue on the job from lifting something that was too heavy or slipping and falling. This is going to be a great information that you're going to benefit from that will help you to find some answers to get the questions that you've been looking for addressed. So let's go right into it. I'm Dr. Toby. I'm a physical therapist, and I've treated hundreds of people with back pain, helping people to avoid surgery, use of medication, and using injections or depending on injections to take care of their back pain. So I'm really passionate about this topic because though in some circumstances surgery and those other forms of interventions can be necessary, I found in so many cases people who have had issues that are so mild or moderate or that are treatable with physical methods, people are being prescribed to get a surgery and being forced and encouraged to get surgeries that once you cut open individual, you can't go back, right? And so I love helping people to avoid these issues and being able to get back to doing the things they love. And the reality of it is when people get these invasive procedures or these medications or injections, sometimes they become dependent on them. And in the worst case scenarios, they're never able to do the things that they were able to do in the way that they were used to doing them. So whether it's playing a sport or whether it's picking up their kids or whether it's going back to work and being able to lift or do activities or moving a patient, if you're maybe in the healthcare field like a nurse or something, people are oftentimes not able to go back to doing things the way that they were able to do them before. And so as much as we can prevent unnecessary surgery, it's extremely important. And I found that it can be done on so many occasions. So what are 5 signs that physical therapy can help you actually relieve and restore your back? So number 1 sign is if your pain is associated with motion or alleviating your pain happens when you're at rest, and that is a sign that physical therapy can help. So with pain or that is invoked with movement or relieved with rest, that is an important indication that physical therapy can help you relieve your pain because we are movement specialists. And when pain is invoked due to movement or pain is caused by movement, there are things that can be corrected in your movement pattern and how your joints and your muscles are moving, such as helping the muscle tissue to move better and to contract better, or helping the joint to be released so that whatever stiffness or whatever hindrance there is in your spine, that can be corrected. And so with movement, that is one of the most important signs of physical therapy being able to help you. If movement or the absence of movement helps or relieves or aggravates your pain, then that's a sign. Number 2, if your spine or your back is tender to touch and there is some tenderness on a superficial level, then, or even a moderate level, then that's another sign. There can be internal issues with someone's back. Like sometimes people have back pain that's really due to kidney issues or um, due to cancer or other situations that are going on. And as a physical therapist, we're able to tease these out. But tenderness that is superficial to a muscular or joint level is an indication that you can experience some relief just by us doing some basic techniques, whether stretches or hands-on techniques that we're skilled at doing. And so that's sign number 2. If you have tenderness to touch, it's an indication that physical therapy can provide some help to you, although there could be other conditions going on that may not completely absolve the entirety of your pain. The tenderness is an indication that there are some manual and physical interventions that can help relieve your pain right now. Number 3, indication that physical therapy can help you and that you need to talk to a physical therapist to help address your pain is if you have discomfort when it comes to sleeping. Right. So if you have challenges finding a comfortable sleeping position, that's a sign that physical therapy is something that can help you, because we not only do hands-on stuff, we provide you education to know why your sleeping position is causing you pain and what to do to correct it and to reverse it. Okay. One of the things that we often can recommend is utilizing pillows or wedges to improve the positioning of your spine when you're in different positions. Some people are side sleepers, some people sleep on their back, but there are things that you can do to relieve the stress and the pressure by using pillows. And so that's another important aspect to look at. Number 4 sign that physical therapy would help you to relieve your pain is if you've had pain for a long period of time. If you've had chronic pain for a long period of time, that is an indication that physical therapy can help you. And the reason is because physical rehabilitation is a gradual process that helps you to restore and to reverse that gradual process of increased pain and inflammation. And with long-term back issues or back pain, the reality of it is there isn't just one simple thing that's causing your back to be in pain. There are a host of different body parts that are involved, whether it is your muscles, whether it is your joints or nerves. And so after having pain for such a long time, 6 months, a year, 2 years, you need a gentle restorative process and procedure to help address each of those aspects one at a time and doing it in the right order. So maybe the original injury you had was a car accident that your back never recovered from, or you had a surgery and now you have a fused spine and it's been a year or more and your back is just still problematic, still hurting. Well, the truth is, because of that, you've probably compensated your posture. So certain muscles are tight and there's probably sensations that may go down your leg because your muscles are tight. Your joints are also closer together and that's causing nerve impingement, sending sharp symptoms or burning or painful symptoms down your leg. So there's a combination there. And in order to address that combination in the most effective way, you need someone that's skilled who can give you guidance to say, hey, this pain is being caused by this. You're sitting in this position. And even though it feels like it's a position of comfort, it's causing pain in another area of your body that you're experiencing. So if we can correct that, you'll experience some relief. All right. And sign number 5 that you would benefit and need physical therapy for your injury is that you've had some type of traumatic occurrence that has happened to you, whether you lifted something the wrong way and you have a slip disc, or you have a herniated disc from what your physician told you, or you threw your back out, or you have stenosis or arthritis in your back. Those are all signs that you can benefit from physical therapy and that you actually need it to help you get better. A traumatic injury, like I already mentioned before, also affects multiple body tissues or multiple areas of your body, not just your skeleton and your bones, but your muscles and other elements. So that being said, if you've had a traumatic injury that has affected your back, physical therapy will help you to restore from the intense, acute, or early phase of that injury to getting you back to the point of being able to have a resilient body, so that when the next time is that a situation happens, your back doesn't blow out, or you're lifting something and you don't, feel a pop in your back. All right, so that's one of the things that's really important. I hope this video was helpful, and I want to share with you, if any of these signs apply to you, you can click the button below to schedule a conversation to have with a physical therapist and one of our movement specialists who will be able to give you guidance and answers to your specific challenges. And so I hope that this is very helpful for you. Go ahead and click on the link below and you can schedule a time to talk and learn more about your particular condition and how you can actually improve it and get some results immediately right now. So I encourage you, talk to a physical therapist first, talk to a back specialist first, and you can do that by clicking the link below and setting up a time to have that conversation, get answers to your questions, start figuring out how you can get back to doing the things that you love the most, and how you can start relieving your back pain. You don't have to live with this pain forever. It's not a death sentence or a permanent thing. There are things that you can do to improve it, and it starts with you talking to the right person, getting the right education and information, and I hope this was beneficial for you.